without an effective medical intervention such as a vaccine or treatment, so to speak, there is no such thing as zero risk. Especially with viruses that can mutate, there is no such thing as a zero risk game. And so it's really a phased approach about how do you kind of come back online in a way that maintains the health and safety of our community. So right now we're in the phase of how big is our problem? And the best way to understand that is testing. Whether it's testing people that are sick right now or getting antibody testing available to see what that immunity looks like. And even antibody testing, again, I know a lot of people have been seeing it in the news, it's not been fully vetted, and it only tells you whether or not you have antibodies. It doesn't tell you whether you are immune to get reinfected, what will be your response afterwards. We know for viruses in general, if you've been exposed to it and recovered, if you get it again, you tend to have either milder symptoms, but that's not necessarily a given with COVID-19. We're learning that COVID-19 doesn't like to play with a lot of the same rule books that other viruses do. So really, in terms of the end game, you're not going to go to zero risk ever, especially when it comes to virus, but you're looking at doing it in phases. So the first phase is understanding how big of a scope the issue is. Then from that phase, understanding who is our most vulnerable population. We understand it's elderly, people with comorbidities, individuals living in congregate living settings. But then how do we protect our most vulnerable populations? And then again, when we have a vaccine or a treatment course, how do we properly distribute that as well? And so it's going to be a phased approach more than anything. There's not going to be a finish line. It's not a marathon. It really is an ultra marathon. And I think of public health a little bit in this conversation because we might come out in the winter and feel like we're back to normal a little bit. We're having holiday get-togethers with family members. We understand the risks that individuals have. But remember that public health is going to still be contact tracing. They're going to still be looking at positive tests. And then when it comes to vaccines, when we learned from H1N1, large vaccine clinics were being done through your local health department. So that's something where we're even thinking of in 2021. So how I see it compared to the general public is going to be slightly different because this response for local health departments are over 2 years in the making right now. And so I think it's going to be phased. There's never going to be a time that you feel like there's zero risk. But I said it yesterday, I believe, and I'm going to say it again. One of the biggest things you can do coming into the fall is get a flu vaccine. It's going to be imperative. And it's, again, not only to protect yourself and those around you, but also to protect our healthcare system as well. And so I wish I had the answer. I really do, because I think that would make my life easier as well. But we have to recognize the fact that as viruses work, this is going to be a phased approach to getting back to normal, and there's going to be different markers and different milestones based on each phase. And right now, the phase we're in is understanding the problem, and that means testing, testing, testing.